Evening, everyone. Hello, Bill.
Hello, Jackie. Good to
Lovely to
see
see
you
you
as ever.
again. Yeah, exactly. Um, so something happened recently with a friend, and then I put a post out about asking for healing for this friend. Um, and then I got back in touch with Bill because with what I found out about German new medicine when I worked with Bill, I did 6 months course once a month for 6 months last year. Didn't want to go further with it because it was such a commitment, a 4-year commitment, but it is absolutely phenomenal. And Joe Hayes had first said to me about German new medicine. He'd gone along to a couple of introductory weekends with Bill and said, it's just so worth knowing about this German new medicine. And so I went along, and honestly, when you first explain, leave everything that you know about pharmaceutical illness, anything like that, leave it at the door and come in with an open mind. And that was such a good introduction, that in itself, without everything that you went on to say. So yeah, thank you, Bill. And if you could start off with a bit of an introduction about German new medicine and the wonderfulness of it.
Sure. Thank you, Jackie. And evening, folks. So, German medicine itself is a causative therapy, and it's all about going back and finding the cause. And we're working back from the symptoms and looking at the organ, the tissue type, whatever we have to look at, the diagnosis, and going back to the cause. Now, thankfully, Dr. Hamer, who's genius of a body of work this is, he it's over 40 years study with Dr. Hamer, who not only was a medical doctor, he was the youngest ever medical doctor in Germany, and he was also had a degree in theology before he became a doctor, and he was really passionate about the connection between ourselves and the bigger picture, and not just the physical body itself and the mind and the psyche and subconscious and everything outside there as well. And he knew there had to be more to it than what he was taught in medical school. And but what really started him on this journey and the way that it did was the tragic loss of his son Dirk, who was shot by the last Princess of Savoy in Italy, and he his son tragically died 4 months later. And a few months later, Dr. Hammer developed a cancer of the testes, and he'd always been healthy before this, and he knew, though he didn't know how, or it had to be attributed to his son Dirk. And he started his journey there, and thankfully, he was working as a chief internist in a ovarian cancer clinic and out there, and he started it. All he had to go on at the time was a loss, a sudden, unexpected loss, because even in the 4 months that his son Dirk was in hospital, he honestly believed he could save him. He'd lost a lung, big part of a lung, and a leg, and he thought he could save him. But there was, um, let's say, there was lots of bad stuff going on because of who was involved, and the people involved in that crime, and they were desperately trying to cover up what had happened and deny any blame. And so when they were in that situation, Dr. Hammer interviewed all the ladies in the hospital where he was working. And the only question I had was, have you lost someone suddenly and unexpectedly? And he guessed it the last 2 years and started from there. And almost every single lady said yes. And I said, well, there has to be something going on here. Then he started looking at different organs, and it's just the facts were there. And he realized over the years that every organ has a different type of conflict shock that would trigger a response in that organ for extra cells trying to produce to assist to aid the organ to deal with whatever it has to deal with better, or even to lose some of the tissue in that organ temporarily. So as when the tissue refills, it could grow back stronger than it was before. Just like what happens in a gym. If you go to the gym and exercise your muscles, you break down the muscle tissue, and now you put a stress in the body that it can't deal with. So it has to grow more tissue. And the only way that can do that is to ulcerate the muscle tissue first, or necrosis, ulceration. And then in the next few days after the exercise, then the tissue starts to refill and regrow. But it grows back stronger and thicker than it was before, exactly with a broken bone. And this is why the pain is in that healing phase, like after the gym, you can call that a healing phase. The tissue's regrowing and refilling, and which makes that part of the body stronger or bigger than it was before. So there's always a biological purpose for anything that happens in the body. Nothing happens by chance. There's always a cause. And the general medicine perspective, we're always, always, always looking at two things: circumstances and relationships. That's where we're looking. Now, Dr. Hamer tells us, thankfully, the type of situation we're looking for, what type of circumstance or event or relationship issue. And we don't know the specifics, but until we start asking the questions, our job is to ask the right questions. And so say, for instance, someone's got a skin issue, they've got eczema type symptoms. We know that there's only one cause from a Gemini medicine perspective, and that's separation. So we're looking for a separation type conflict, then we're looking at the time frame. When do those symptoms start? Then we're looking for, strangely enough, a resolution of a separation conflict before the eczema started. But eventually, when it becomes chronic, it just keeps stepping on a track and getting re-triggered all the time. So every organ's got its own nuance, its own conflict, and we start from the end of the line, as in the symptoms or the diagnosis, whatever we start with, and then backtrack in the time frame to the circumstance of the relationship event or events that keep on occurring and keep getting re-triggered. So, and people say, well, what's the therapy? What's the cure? Well, it's in the subconscious mind. We have to connect the dots between the conscious mind and the subconscious mind for the body to say, okay, it's over and done with. They can start diminishing those symptoms piece by piece. And then understanding the awareness of what type of conflict is getting re-triggered all the time. And then we can help the person look at the circumstance and the relationship issue. Who is it? Who or what is in the picture? Usually a person. Person or a pet, there's always something or someone in the picture. And even our circumstances nowadays in life, there's always a person. So whether that's authority figures, heaven forbid, or it's anyone else outside, or it's part of our family, our friends, our partner, our children, our neighbours. So this is where we're looking from all these different directions at the one time. And my job is to ask the right questions. So that's a very, very, very brief description of Gemini medicine. And the therapy is joining up the dots between the subconscious mind and the conscious mind, because the subconscious mind is literal black and white, present tense. And we have to tell the subconscious mind it's over, it's done. Through joining up the dots between the circumstances in the relationship issue and the end of the line symptoms or diagnosis. And then start from there to try and diminish, and diminish these tracks and triggers. Every chronic issue has tracks and triggers. They keep getting re-triggered. We keep going to see that person, get stuck in that job, that situation, that neighbour, whatever it is, or get triggered into that fear or that anxiety or whatever's going on. So I'll shoot you a Jackie for a second. And
You're
was
lovely.
that enough of a description?
It was, yeah. Because also you told us that once you've got the symptom, that is healing. That shows that the trauma,
Usually.
usually, yeah, the trauma is over, or you're starting to heal from the trauma by
Yeah,
having a
every organ's,
symptom.
yeah, mostly, I would say 70 to 80% of the reasons people go to the doctor or hospital apart from accident, emergency, and drinking a bottle of bleach, then most of the reasons people go there are healing symptoms, or they're getting re-triggered the chronic. Like say someone with asthma, for instance, they may have a big crisis and need to go to the doctor or the hospital or something. Then obviously, yeah, you stepped in a track and get big symptoms. But most of the reason people go there, say apart from accident, emergency, and things like this, is a healing symptom. Like your colds and your flus and anything with itis at the end is a healing symptom. Laryngitis, bronchitis, cystitis, whatever it is, blepharitis, they're all healing symptoms. And obviously you don't want the symptoms, of course not. But
But we
the,
would never look at it as a celebration, whereas you said, could be a celebration, because if you get the symptoms, you know that you're starting to heal from the trauma that created.
yeah,
I know that's a bit brief, but
I wouldn't use the word celebration, Jackie, but
oh, no.
lots of people give you a smack for saying that when they're in deep healing symptoms and people suffering. But yeah, it could be, or someone's in physical pain in a specific area of the body, musculoskeletal pain, then potentially they've either stepped in a track or got re-triggered with a self-worth conflict, which are universal by the way. So, or they're born into healing. They resolve the self-worth conflict connected to that specific area. And every single area in the body, the musculoskeletal system, has got a different type conflict connected to a different type of person, whether it's your mother, your child, your partner, or your enemy, or whoever it is, on a different location as well. And especially the musculoskeletal system, you have to look at what's the function of that part of the body to give you a clue to what type of situation. Like someone came to see me today and showed me some pictures of really, really massive swelling on the outside of the hand. Now, this area is really about exactly what we do with it. It's about wanting to smack someone out of the way, literally. And it could be physical, it could be metaphorical. And when we feel we do, then we get into healing. So swelling, inflammation, pain, healing symptoms. So any swelling and inflammation are healing symptoms. And I know lots of people say, well, inflammation is the cause of this or that or whatever, but from a German medicine perspective, inflammation is healing.
It's
So
literally thousands on the website, on the German New Medicine website that we've got, the A to Z of symptoms that you can have. The lady that actually filled that in took 4 years to do that research, and but it's quite incredible. Whatever symptom you can think of, it's in there. So we will start with some questions that we've got, because there's probably quite a few people on here that might want to ask questions. And I will just say
yeah.
that we are recording this. So if you don't want to be seen, but you do want to ask a question, then by all means pop it in the chat box and I can ask Bill.
Okay, I'll turn my camera off now, Jackie.
Not appropriate. Okay. So yeah, is that all right if I start by asking you a couple of questions that have come in, Bill?
Absolutely, Jackie.
Lovely. Okay, so my friend who had chicken pox when she was young, she's just had chicken pox again. And is it contagious? Because from what we learnt with you, there is no such thing as a virus, which is a big thing as well, isn't it? So, and if there's no virus, or you can't catch a cold from anybody else, can you catch chicken pox from anyone else?
Afraid not. Although in many situations it seems like it. But again, we go back to circumstances and relationships and how we feel about or perceive those circumstances and relationship. Okay. So say for instance at school, you get the children in the classroom and you may get quite a few of the children with symptoms. Okay. And the top layer of skin, generally speaking, So generally speaking, because there's tissue underneath this top layer of skin as well, where you have different types of symptoms, um, like shingles or boils and things like this. That's a sort of the slightly deeper layer of tissue. But the top layer of tissue itself, anything that itches is a separation conflict when it goes into healing. Or all the spots that you see in the measles, or the chicken pox. Chicken pox is about the deepest you can go in this top layer of skin into the next layer. Now, separation conflict that's been resolved the very first time it happened. If it happens after that, at any time, it's been re-triggered. So separation conflict. So take the children to school and the favourite teacher leaves. Or maybe it's their first day in school. You can get a few kids getting separation conflicts. Now, when the separation conflict is active, there's microscopic ulcerations under the tissue of the skin. Now, two reasons here. One is to make that tissue more numb, so that loss of separation is not as intense. And there's also slight memory loss as well. Now, it may not be noticed, but it's there. And it doesn't matter where it is in the body, it gives you a slightly different content to wherever it is in the body. But say, for instance, the favourite teacher left or was sick or went to have a baby or whatever it was, or and then they come back. So when the teacher's gone, the favourite teacher, and maybe only a quarter of the class or half the class, that's the favourite teacher. The other kids are not too fussed either way. Or maybe they're not sensitive to separation conflict. They're sensitive to other stuff. So the teacher comes back. Now they can go into healing for that separation conflict. Then you can have what they call an outbreak. Oh, there's a few children. They're spreading from children to children. But here's ask the question, why not all the children?
Yeah.
Because it has to be all of them or none of them. And you can't have some of them without the other ones being affected who are sitting in the same environment. It just can't happen. Or maybe it happens in the home. Someone gets a cold or a flu, and you may get maybe 2 or 3 people in the family get a cold or a flu, but the other 2 or 3 don't. Why? Same environment. There's no contagion. It can appear like it, but we have to look at the circumstances, the relationship with that person who had the symptoms. So when someone gets re-triggered, like your friend who's been re-triggered with the chicken pox, she's been re-triggered by another separation conflict.
Interesting. And
So
that makes
and when we get
absolute
re-triggered,
sense
we
as
go
well.
straight to the symptoms. Sorry,
Yeah.
Jackie, but when we get re-triggered, we go straight to the symptoms. So it's like you do not pass go, you do not collect 200. So
Mm-hmm.
this is why it's a bit tricky with attraction triggers. But there's no such thing as any of this stuff like measles causing mumps, and it's fiction, I'm afraid.
That is
So
so interesting. Just to say as well, it's come to my mind is when someone's got this, if you wanted to know a German new medicine perspective, how do people find out? Like it would be that there's not a whole lot of people we can get in touch with, is there, through German new medicine?
um, very thin in the ground in the UK, much more so in Europe and other places. But
Because
yeah,
it,
I can certainly get in touch myself. But also, I've also produced a series of webinars last year. I think it's 12 in total, walking through all the steps in GNM if anybody wanted to learn it, and walking it through from scratch, right from relationship type issues to understanding the GNM piece by piece by piece. And it's a really good foundation stone for anyone wanting to learn more. But yeah,
we'll give Bill's, in fact, I'll put his email in the chat box. Is that all right, Bill?
uh, if anyone wants my details, just get in touch with Jackie.
Okay, lovely. Do that. Right, next
And
question.
the only reason I say that is because once it's recorded, I don't know where it goes.
Oh, exactly. Yeah, good. No,
As in
absolutely.
people share it, not you, Jackie. It's too implicit. People sharing online and
Oh,
whatever.
exactly. No, that's absolutely fine. So, a lady's asked, I've been diagnosed with reflux. Oh, don't even know how to say that word. It's OESOPHAGITIS.
Oh, you asked me that.
Yeah, and a
Also the guy says,
sliding
yeah.
short hernia. I'm also on esomeprazole twice daily, worried about the side effects. Any help with this matter would be appreciated. I did send you
So
that one, didn't I?
I don't, yeah, I don't actually know. I don't mention medication. I'm not a medical doctor, so obviously I don't mention anything from the medical field. What we're looking at tonight is causes,
Pauses,
okay,
yes.
and what we can do to resolve the cause, okay. Um, so with the reflux of the esophagus, then again with itis, it means it's a hanging healing. So esophagitis, esophagus itis. I don't know how to say it either. So really, it's about split into the esophagus is split into sections. There's two upper sections and one lower section, and they're controlled by different parts of the brain. So, but the top sort of 2/3 that would cause those sort of symptoms are the conflict is not wanting to swallow a morsel. Now, a morsel is a strange word, but it could be a person, it could be a situation, it could be money, it could be food, it could be medicine. I don't want to swallow that. I want to spit it back out. Like we used to say, yeah, it's just left a bad taste in my mouth. I wanted to spit it back out. Now, it could be something like accusations, it could be judgments, it could be criticism, it could be insults, but it could be anything at all. But it must have affected the lady in a big way um, to start off with those sort of symptoms. And maybe she's getting re-triggered because it's something that's too hard to swallow. I just want to swallow that, I want to spit it back out. And there's always potential anger in the mix as well, because it's about having to push this stuff down, and it's quite hard. And then when that conflict's running, you'll get maybe mild sort of we've got heartburn type symptoms. Um, but this is the first time event, not triggered, re-triggered, okay? Excuse me. Then and the healing, they could have difficulty swallowing and pressure type pain. Uh, it's a bit scary. It's always a bit scary. You can't swallow and you can't breathe and you think you're choking. It's scary as heck. So that's the type of symptoms that are going on there. So really, you're looking for the anger, and then in the healing crisis, you can get acute sort of burning pain, the heartburn type stuff, and it's the sort of stuff that people with milder versions would take, something like the Gaviscon type of stuff, which is super common from what I hear. And I even found a bottle lying in the hedge row and some of the country lanes I walk up and down. I thought, normally it's wine bottles and stuff like this after a weekend, but a bottle of Gaviscon in the hedge. I was like, how far have we come? Oh my gosh. And so, so I really want to look at the anger and your territory has been pushed down, and also not want to swallow that situation, those words, those insults or behavior or whatever it is. So to get out of that picture. Now the medication, when someone's in healing, then it suppresses the symptoms temporarily until the medication wears off, then they're back in there again, and so it goes on. And so, as a good doctor said to me one day, he said, Bill, medication never cured an illness in a life, but they're really good at suppressing symptoms.
Wow,
And I
absolutely.
remember saying, wow, that's a big statement to make. He said, we all say it, all the doctors say it behind closed doors, but we have to give them.
Yeah, absolutely. And that obviously the pharmaceutical industry doesn't want German new medicine to, yeah, we know.
So they tell me. So they tell me.
Yes, it's
So with the sliding hiatal hernia type stuff, um, it's more so the diaphragm and the stomach being affected. And the diaphragm's all about breathing, and what's coincides with the heart. And so it's really about the breathing and not being able to breathe, or the feeling they're not able to breathe, being suffocated, and or not being able to breathe deeply enough to take the air in. And this is an overwhelmed type conflict, feeling overwhelmed, too much, it's too much, um, too much pushed down, just, yeah, that sort of situation. It goes on and off for a big while, or a really big conflict that affects someone in that way. Excuse me. And initially you make it a bit of paralysis in the diaphragm. So um, your body's got a backup plan everywhere in the body, and it just stop you doing damage, and you get a little bit of paralysis because you also feel stuck as well. That inability, that overwhelm, you just like don't know what to do. Um, but eventually that can lead to a rupture in the diaphragm and the muscular tissue, because it's muscle tissue really, and it should be floating. It's also protection for the heart as well. But eventually, when you damage the little part of the diaphragm, then it weakens the tissue, and then the stomach wall can push up with pressure, and this is what comes up through, enters into the diaphragmatic sort of area. So you get both these going on at the same time. So it's, you get that. So she's been aware of any pulling or pushing or straining or anything that could aggravate it. And if someone carrying a bit too much weight, that will be problematic as well. Or if someone's retaining water, that would be really problematic, as it would be in any type of other symptoms. Because water retention amplifies all symptoms in the body, and it can cause big complications. So we really want to diminish the water retention as much as possible. And I know every modality will say, well, drink lots of water. There's a time when you don't want to drink as much water. But when you get into the crisis of the sliding facial hernia, then I get big cramps and breathing difficulties. This is where any sort of relaxation sort of techniques, or any techniques at all, will help bring someone down, um, or friends or connections to make them feel less overwhelmed, or look at the circumstances, the people in their life are causing the overwhelm, or the pressure they put on themselves to cause the overwhelm. So we have to deal with all of this and bring these down. And sleep apnea is part of the same story with this, with the diaphragm or the heart, um, where they get re-triggered all the time. And it's like our body's like try to take an extra breath when we're sleeping. And obviously that's scary as heck when you wake up. And so you just, it becomes chronic. You just get relapses all the time. So you want to diminish, diminish, diminish. This is when we have to make a lifestyle change and change our perception and connect more with other people, and sort of diminish with any symptoms. If you can't, even if you can't resolve them, diminish, or try and get a new perspective on things. So
it's like change your thought processes
yeah, we have to.
around. Yeah, yeah.
Yeah,
Thank you,
yeah,
Bill. Like, we've got a lot of questions, so we'll go on to the next one. But it gives an idea, doesn't it, of a different perspective on illness, rather than just looking for a pill that's, like you say, just like a plaster over it rather than a cure for it. Um, Jude's put the likely cause of chronic bronchitis of the left lung from the perspective of German new medicine. The likely cause of chronic bronchitis from the left lung.
All right, okay. So really the bronchitis itself is about a fear in your territory that's been re-triggered. So literally that fear in your territory, it could be like the sort of situation where you go, that sort of thing. But it's been running for a long time. If it's chronic or if it's in a child, excuse me, shouldn't do that. Breathing in, can't do that and talk at the same time. So it really depends on the time frame and what medication someone's on. So if the bronchitis type symptoms have been running for a long time, they're just stepping a track and getting re-triggered with that fear in their territory. And then eventually, with any chronic issue, especially to do with breathing, it's a big deal. Of course it is. We have to breathe. And it's really, really scary when we can't breathe. Super scary. So again, we have to find one, what the tracks are. So look at the circumstances in the relationship. What just changed before the symptoms changed? Always ask that question. What just changed before the symptoms changed? Either started or changed. Because this is our job. We have to find what it is that trips us up every time. Because otherwise we're stuck in the loop. And what happens is if we take medication for this, then it keeps us, it diminishes the symptoms and diminishes the healing crisis, and then takes us back into the conflict state again, especially when we use something like steroids or something like this. Then when the drug wears off a little bit, then the body always tries to go back into the healing, always. So then it goes back into the healing, then you have to take more drugs or a stronger drug or whatever. So, but the conflict you're looking for is that fear in your territory, whatever that is. It could be a financial fear. It could be a fear of a person. It could be fear of the neighbour's angry dog. It could be fear of your boss. It could be a fear anywhere. It could be a fear when you're driving. It could get triggered when you're driving. Bronchial fear. Maybe you're a bit super sensitive to accidents because of a past trauma or injury or accident. And it depends what age it
Yvonne's
started.
saying, because it's the lungs, could it also have something to do with mourning, like grief?
Overnight, your body's trying to heal more. When you're sleeping, you're trying to heal more. So you can get symptoms in the morning when you wake up, and then when you start moving about during the day.
Oh no, sorry,
So, but
mourning
there could
as
be a
in
tracking.
grief, Bill.
Oh,
When
morning.
you're in
Oh, that's not a
mourning.
morning. Oh, that
Sorry, yeah.
morning. Um, if that brings up a fear in your territory, I know lots of people talk about your lungs to do with grief. Fine, it's not GNM.
It's not. No, oh, okay.
But if that grief brings up, yeah, it could bring up any type of issue like an overwhelming conflict or feeling all alone or territory fear. Then our territory is anything from our body outwards. That's important to us, and that includes our environment, but it also includes our values, our beliefs, and everything. So, but again, look at the circumstances that changed just before the first symptom started or before you get re-triggered. But looking for a perspective of a territory fear, if it's a bronchi.
So interesting, really, to look at it this way, because when you get an illness, you're more concerned about getting better than thinking back what happened before. And another thing that you always said to us about was if you go for a diagnosis, if you're going into the hospital, to take the telephone. I think that's so important for people to know that you've got every right to record. Can you just
Yeah, and
speak
thank
to
you for
that
that.
a
Nice,
minute? I think
Jackie.
that's worth
Yeah,
knowing.
absolutely. And thank you for reminding me. So, I'm just glad you were listening, Jackie, in the class. Good
I
girl.
thought that was so interesting and so worth knowing.
All the girls and guys sit in the front, Jackie and Joe. Before you go for a diagnosis or prognosis, either take someone in with you who's not going to be affected by that diagnosis, but definitely take your phone in with you, or take someone with a phone if you don't have one, and record the conversation by audio, not video, and press record before you go into the doctor's office, because people who are nice will find it really difficult to press record in front of the doctor. Press record before you walk into the room. Take your phone as soon as you walk in and say hello. Put your phone on the doctor's desk and just respectfully say, you don't mind if I record this, doctor, because I just can't think straight right now and I don't want to miss anything. Now, if they say, no, you can't, then you have to call in as your legal right, which it is, to record it for your own personal use, not for YouTube, your own personal use. Okay. Now, what that does is two things that will benefit you massively and stop any further shocks hitting you yourself, and just in your mind, through your intention, take that energy into the phone rather than coming directly at you. And it also causes the doctor to diminish the way they speak to you and soften how they speak and communicate, because that conversation is admissible in a court of law. Now, I wouldn't take bets on anyone winning a court case with the medical system, but it is admissible. And doctors, that is there for life, that recording. They'll be more respectful in their attitude, shall we say, if they're not already. Super important. Super. It can save you from getting a secondary conflict somewhere else in your body. It's that important. It's potentially life-saving.
Marvelous. Yeah, I thought that was such good advice for us. And I don't know if you've got any short stories. I remember you told us one about the strawberries. She was eating strawberries when her husband said that they wanted to finish, and then she could never. There was always a situation. I mean, it doesn't have to be that story, but just to show how something, they're walking through the forest and she was eating strawberries, and then she could never eat strawberries again, but never put it back to the fact she was eating them. Something
You
like
got the
that,
memory.
Bill. Just a simple, to show how easy, and you could forget even what could have caused it, but it's something is, well, not simple, but that was the trigger for her.
Yeah, we're talking then about what they call allergies or sensitivities to certain substances, whether it be food, smells, taste, sight, sound, whatever it is. Then something along the lines of that example was you're walking through the countryside with your partner, and you look at his phone or her phone, and you see a message from someone else, and you think, "Oh, who's that?" And whatever you're eating or drinking at that moment in time, and if that's a shock to you, or they say something like, "Well, it's over, I've found someone else," or whatever it is, that's a shock to you while you're eating or drinking, whatever that is at the time, then everything is locked in your psyche, and your subconscious mind is like, it's like your phone. It takes a snapshot of every millisecond of that negative event, and it store all of them through your whole life. So when you're ever eating that food stuff or drinking that food stuff or whatever, especially when you're in a bit of stress, then your body's gone, no, 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 not again. No, no, don't do it. Look what happened last time. Just because of the food stuff, or whether it's the milk or the dairy or the wheat or the strawberries or the chocolate or the wine or whatever it is. So that was in the original conflict shock, and it gets reactivated. And then eventually the foodstuff or the drink becomes the trigger. So, you know, and depending on the reaction at the time, or the reaction when you have that drink or that foodstuff, can give you a clue as to whether it was a separation conflict, as in if the skin reacts in some way because of the substance of the drink or the foodstuff. You know, you perceived it as a separation conflict back then. If the food or the drink creates a digestive issue, say, you know there's an anger or a sense of lack in that conflict shock. So it can give you a bit of a clue into what the nuance of the conflict was at the time, and then it's easier to look for tracks and triggers as you're doing that as well. So,
Thank you. What could be the likely cause of a knee pain, especially the left knee?
oh, the knee pain, the left knee.
Knee,
It depends
yeah,
whether the
sorry.
person's right-handed or left-handed, strange enough. Um, if the person's right-handed, for example, then, and this is different to what everyone else talks about, I'm afraid. So if you're right-handed, naturally right-handed, then your left knee is related to a mother-child, or your whole left side of the body down the midline. We're talking about musculoskeletal stuff here. And the knee is really about, and it's about self-worth, but it's about sports or movement or dance or some form of activity. And it could be gardening, it could be kneeling down, it could be whatever it is, or playing tennis or whatever. And the left knee is connected to, so the persons would be mother or child. Now bring pets in here as well, because lots of people have pets and they treat them as a children. Could treat them as your partner, could perceive them as your partner or your child. Hopefully not mother. Or so it could be you the mother or your mother, or you the child or your child. Now the conflict is about sports, drama, dance, movement in some way or other. So if that's a first time event, they've resolved a conflict around self-worth about any of these, you know, sports, dance, drama, whatever it is, activity, where they felt better about themselves just for a little while at very least. And then the tissue, which has been, like a necrosis, like a shrinking of the tissue and the muscles, the tendons, the ligaments. And, like we spoke about before, you go to the gym and you break down your muscle tissue, then a few days later it starts to regrow. Well, the day after it starts to regrow and it's painful. And depending on how intense this original conflict was in the left knee and how long it's been running, it determines the intensity and duration of the healing phase, as long as it's not interrupted. Or heaven forbid punctured. Never puncture a joint. Um, Never. So really to understand this, and this is when you use the compresses, or if you can get into a cold Epsom salt bath or just warm Epsom salt bath, or ice packs in the head or in the knee, really beneficial. But I'll give you an example. There's a chap I went to see many years ago, many years ago, and this chap took up the whole door frame as I walked in. It was a psychic friend who had recommended this chap come and see me, and she said to me, she'd pre-warned me, she said, "Bill, this guy is not in any shape or form woo-woo. Okay, I'm just saying this off the bat, right? Okay, so don't talk about energy and all that stuff." So I went to see this guy, and he was there like that. The whole door frame was filled by him, and I went, "Oh my gosh!" I'm looking up at this guy. Uh, and I said to him, "Oh, you play rugby then?" He said, "How do you know?" That's pretty obvious. And we're sitting down talking. So I'm looking for the conflict shock resolution to his knee that was like a balloon. He could hardly stand up, could hardly walk to the door. and he was in a lot of pain. And so I asked him, "Are you still playing?" He said, "Yeah, I'm still playing." Um, he said, "How was your last game?" Just before he said, "I played better than I've played in my whole life." It was a stormer of a game. I said, "Well, what position do you play in?" He said, "Up front, scored a few tries and pff, hero of the match." I said, "Well, guy, your side, you're always going to be hero of the match." He just laughed and said, No, I was the hero of the match, the real one." And I saw some pictures up in the wall, and it was him. I'm assuming it was him as a boy with his dad, rugby pitches, rugby outfits on. Um, I said, "Is that your dad by the anyway?" He said, "Yeah." I said, "So he plays rugby as well?" He said, "He was an international." I said, "So you learned to play rugby from him?" He said, "Yeah." I said, "Man, what an awesome start to your rugby career." Nothing, absolutely nothing. And I said, "Did your dad praise you much?" Tears,
Oh dear.
blood and tears. This massive hulk of a man, and he was just in bits. I said, "Your dad's not here?" He said, "No." He said, "When did he die?" He said, "Before I made the grade."
Oh,
I said, "Does that bother you?" He said, "Yeah, it bothers me." Because I never ever proved to him how good I was. The last 2 years of his matches, he wasn't on best form. This last game, he was in top form. All that praise and accolade, that put his knee into healing. And his dad was the original conflict. Never good enough. And because that game was a stormer, his best game ever, one of the guys come up at the end in the bar and said, "Your dad would have been so proud of you." Gone.
gosh, that is so meaningful when you hear a story like that, Bill.
And without genuine medicine, you'd never work this stuff out. Just never.
No.
Because everything in genuine, not everything, but most things in genuine medicine, back to front, upside down and outside in. Because we are looking at something that's seriously wrong. Of course it is. The guy can hardly walk. He's in agony. Of course it's wrong. But it's a healing symptom. Or he's
And
been
did he
reclaimed.
understand that from what you said then? Did it sort of,
He got it as soon as he started crying. He got it. And a
amazing,
big man bursts down in tears, breaks down in tears in front of a total stranger, another guy. He gets it.
amazing.
Yeah.
Because we're getting so many questions in, I'll carry on, but thank you for that. I really love that story. Um,
The guy didn't.
no, I bet he didn't, but
And I'm not telling him either.
but I bet he does now. Like what that understanding is so good.
He got it.
Yes. Uh, how would you analyze a heart attack? One of my friends had one suddenly last summer. There's a lot of overlapping with homeopathy, this girl's saying. Siobhan's saying, but anyway, yeah. Oh, in fact, I think you've talked about homeopathy with German new medicine, haven't you? Oh, was it Katie that used to come along and she was homeopathy? Oh, perhaps I got
Yeah,
confused.
there's a few people. Yeah, there's a few people there in homeopathy. Uh, I don't know anything about homeopathy. I know roughly what it is, but I don't know anything about it, so I don't
Oh,
talk
no.
about it.
So yeah, she's just saying, how would you analyze a heart attack? And in actual fact, saying that a friend of mine We went to his funeral 2 weeks ago.
Sorry,
60
Jackie.
years old, heart attack, not even been ill, just had a bad back at the start of the week. And then on the Friday, just died in bed of a heart attack.
Way too young, but a nice way to go.
Yeah,
There's different types of heart attacks, so I can't really answer. There's an overwhelmed conflict where the myocardium, the heart muscle itself, not a pump, but a muscle, because it's actually a vortex, and or you can get a territorial loss, conflict that can resolve in the coronary arteries. It could cause a heart attack. If that conflict's been running for too long, then it gets resolved. It can be fatal. So, and you've got other conflicts with the heart valves, but usually they're discovered much sooner. And yeah, different conflicts. And they also describe a pulmonary embolism as a heart attack as well. It depends on where you are and what's going on. And obviously, because of the nonsense that happened a few years ago, then there may be other stuff in the mix sometimes. That's all I'm saying. We all know what I'm talking about.
we do, I'm sure. Yeah, so thank you. I was asked about glycans. Have you ever heard of glycans?
Nope,
You've not heard of them?
nope.
How
Don't
weird
know.
is that? Because the girl that spoke about them, she's just done a liver cleanse, but she's also using glycans, and yeah. Oh well, I won't go into it if you don't know what they are. So is a liver cleanse a good thing to do? Is the question on that?
That's a big question.
Yeah, it is, I think.
If you're healthy and not in a big healing phase of any organ, fine. But if you're already in healing symptoms of any tissue, a liver cleanse, absolutely not. Because the last thing you want to do is any more deeper cleansing to take you deeper into healing. You really don't want to do that. Really, really, really don't want to do that. And the time to do fasting, cleansing, all that sort of stuff is when you're healthy.
Good question. Good answer. Fear has more to do with kidneys, would you say?
Um, um, no. There's three different parts of the kidneys. Okay. One part, the most important part really, is what they call the kidney collecting tubules. They're the little containers or parts of the sort of like veins with little vessels in them, the way I think of them. And they determine how much or how little urine we pee out. Now, this is a very, very common symptom that gets re-triggered. Now, it causes us to retain water. With any time we feel as though, it's our perspective, that our survival is threatened in some way or other. And it causes the body to hang on to more water, and hanging on to the water, it can reconvert some of the creatine and the urea back into protein if needed. So it can survive with water and protein indefinitely. But the programmed survival, like if we're lost in the desert, but it's really about feeling alone, feeling abandoned, feeling pushed out, feeling left out, excluded, feeling like a fish out of water, a refugee, struggling to keep a head above water, financially or otherwise. Or maybe it's common for someone who's in an old folks home and they don't want to be there, or they've lost people, they've lost their partners or their husband or the wife, or good friends. It's very common in old folks' home where this edema is running, and that's that part of the kidney collecting tubule, that and that conflict activity that will hold on to that water. So we'll retain water more than you would otherwise. Even if someone's partner gives them a dirty look, a woman could retain more water. Or she fears a partner straying away from home, or doesn't feel good in the relationship. She could, her rings or her shoes could be a bit tight that day. And there's varying degrees of this, from the minor to full on. And the other biggest time for this situation to affect that part of the kidney and retain the water is in hospital. When you feel alone, you get hospitalization fear, and you feel isolated, especially during all the nonsense. That was absolutely barbaric to treat human beings that way. Some would say deliberately barbaric. So that's one part of the kidney. The other part of the kidney is if someone's blood pressure is continually raised. There's more than one cause of the blood pressure, but this is continually raised. That would be another part of the kidneys. So, and this part is all about too much water. Maybe someone had a near drowning, or the roof's flooding, they live in a flooded area, or they fear the river rising, or something like this. Then the blood pressure, as a compensatory thing, as long as that program's running, or the circumstances and events, then it'll raise the blood pressure up because it's losing tissue in that part of the kidneys where they're losing some of the nephrons and it has to rebalance. So another part of the kidneys, the more the renal pelvis, that's all about marking your boundary, your area. So you can get these conflicts, and you can end up with things like, along with the bladder, cystitis and things like this, when it gets into the healing symptom, common in teachers, when term ends and all that sort of stuff. So that's the three parts of the kidneys. So
Mm. Atrial fibrillation. Could you
atrial fibrillation.
atrial fibrillation? Yeah, could you speak about that?
Same again, you're looking for overwhelm type situations. But generally speaking, from experience, I would always look for a relationship issue in that, or maybe a separation conflict in there at the same time, or maybe lost someone, or the partner's walked out or walk away or whatever, and they step in a track and get re-triggered. It's very, very common, by the way, very common, and 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 some people have it for 20, 30 years on and off, but it just means you step in a track. Now, some people could also have a sexual conflict going on that would trigger some of those symptoms as well. So, without knowing the time frame and the person themselves, then uh, so again, just diminish, and really for first aid symptoms, get some ice packs in the head while you're sitting up and get them over the top of your ears, both your ears, because the control center for your coronary arteries is above your right, the coronary veins above your left. Just get the ice packs up there in the head.
Oh, wow. Lovely. Um, just went through my other one I was going to say to you about. Oh, yes, tendinitis.
Tendinitis, again, itis at the end. So it means they got a chronic issue going on with that part of the body where the tendons are.
On the
So,
ankle or the foot.
or the ankle, the foot.
Yes.
And the ankle, again, look at the function of the ankle and the foot. So the foot itself is really about uh, direction. It's about movement, and it's flexible in every direction. It's quite incredible. And so whatever tendons are the top of the foot or the behind the foot, is it behind the heel?
Under. Well, sort of heel and under the foot.
Oh, the heel and under. Yeah, the heel could be about wanting to crush your opponent. Or if it's gone up into the calf, from the tendon to the heel bone to the calf, it's more about a sports or activity, movement, walking, running, and a self-worth conflict there. Or again, there could be mechanical damage in there with any musculoskeletal system as well. So either way around. So
The things that you talk about, you often say about self-worth as well. That comes up a lot, doesn't it, for
the
us?
whole musculoskeletal system, self-worth. And that's the muscles, the lymph. There's a light to self-worth. The muscles, tendons, a bit deeper self-worth, and all the way through to tendons, ligaments, right through to the bone. The bone's as deep as self-worth you can have. We really want to resolve a conflict sooner rather than later. You really don't want to get an issue in the bones. Really, really, really. It's super painful in the healing phase, and it's tough. It's not a walk in the park. So this is why the whole thing about understanding Gemini medicine is preemptive medicine at its best. So then we know the potential repercussions of staying in this relationship or circumstances for too long, as most people do. We live in a society that's outside nature. We're programmed for nature. We don't know any different. But our society is outside of nature. We stay in circumstances and relationships for way too long and push stuff down and down and down and get re-triggered all the time. Society is not beneficial to our bodies. So this is why we have to form really good connections with really good people and downgrade how we feel about everything without suppressing, without pushing stuff down or denying stuff. Someone's been abusive or disrespectful, yeah, you have to sort it out. But otherwise, like, try and get a new perspective on things like, is this really that important? Of course, it feels massively important at the time, but as soon as we can, we want to downgrade it as best we can because it's not worth the cost. The cost is always to ourselves.
Absolutely.
Or we
And
affect other people.
and do you look back at your parents or your parents' parents, like, because I think now back to when I was a young mum, my self-worth was not the best. And
Yeah,
I wasn't brought up. I knew I was loved, but self-worth, and it's nothing you would ever talk about, is it? And then you think, have you passed that on to yours? So, and it's looking at that and actually being able to say to them, I wish I'd known this when you were young, or
yeah,
whatever.
absolutely. Absolutely. Really it's all about, I keep meaning to write a book called Cut Yourself Some Slack
Mm,
because this is what we have to do. There's
mm,
not a single person alive, as far as I know, who doesn't have regrets or wishes they'd done this or done this. Yeah, no one. Yeah, we're all human beings. Um, and we all react depending on the attitudes and the behaviors of what we're brought up with.
mm.
And again, it's no disrespect to our parents or our grandparents or anyone else.
Exactly.
That's just how it was.
Yeah.
Um, and as adults, it's our responsibility to deal with how we feel about that stuff and not get dragged into blaming our parents or blaming this or blaming them. Uh, we got to get out of that stuff because the circumstances are true, the pain is true, but it's our responsibility as an adult at some point to deal with that pain and resolve it ourselves. Now we can get re-triggered again, and especially if you're still around your family, the usual family dysfunction, then yeah, of course, super easy to get re-triggered.
I'll look for it in a minute. I did read a very good piece today about a chap. A chap shared this from. Anyway, I'll share it in a minute. But can you just speak about? Oh, I've just forgotten again what it was I was going to say to you. Oh yes, addiction to sugar, and that's not really a German new medicine, I suppose, is it? Because like I'm addicted to sugar, I would imagine, actually.
Yeah, it's common in our society. Yeah, addicted to sugar is really a hypoglycemia type thing. And it can be either a fear disgust type situation that's going on, either close to home or out there, whatever, or resistance reluctance type conflict. And what happens is the sugar level drops, and then we crave something sweet to top it back up again. And if you tested the majority of people in the population, you'd find hypoglycemia super common. And because it's easily temporarily fixed by sugar. And sugar is, the old thing, some sweetness in life, and most people could do with some more, and especially chocolate, which can be quite addictive. And yeah, that's okay. It's no big deal. Now, It is a big deal if you fear sugar, like lots of people talk about, like sugar feeds cancer and all that sort of stuff. And oh my gosh, the, uh, find a sugar you like and find a sugar that's good for you and find it in a means that you like, or whether it's, honey in the comb or whatever it is. And, give yourself a break in this. But if you get a fear discussed conflict or a resistance reluctance type conflict running, and resistance reluctance, I'd love to have tested all the awake people during all the nonsense. And I'll guarantee most of them would have a resistance reluctance conflict going on to do with authority type figures. I'll guarantee it.
Absolutely. Can collective trauma then cause epidemics of illness?
Sorry, what was the first part?
Can collective trauma then cause epidemics of illness? Collective trauma.
We have a collective consciousness, of course, we're all connected. And like, for instance, quite a few of my clients were asking me in the beginning of the nonsense, what the hell's going on, Bill? I'm finding it so hard to deal with life. Everything that I normally deal with is up to here. I said, well, you got to remember that the collective consciousness and all this tripe is about fear, anger, and judgment. Okay? As soon as you open the door in your own fear, anger, and judgment, you get sucked right in to the collective consciousness. And you really don't want to be there. You really don't want. So just show your intention, your mind, any fear, anger, and judgment that trips you up, is almost like, imagine you just get out there and close the door behind you. I can promise you it'll just diminish some of this collective consciousness. And obviously, it's really, really powerful. But we have to create our own collective consciousness. And as soon as we feel ourselves out of sorts, because of what we hear, what we see, what we read, what we hear, all that sort of stuff, and we just got to unplug again and go back to doing the things that make us feel good. But always have to, and I know you do, and Ho'oponopono and everything else that you do, and all the rest of the people, all the good therapists here. Everyone's got their own tools and strategies, techniques that use to get them back into close to alignment again. And it doesn't matter what you do, how you do it, it's great, because the majority of people out there don't have that. I really feel for people out there, I really do, because they're stuck. In some ways, they're free because they don't understand what's happening. That's a big freedom. And they don't understand what's to come. So that's a massive freedom.
Yeah.
But it's going to kick them in the ass in the end. Now, in the present tense, most people can only manage through suppression. They can't manage. If you took away the suppression, well, it's the noise, the drama, the shopping, the sex, the busyness, the drugs, the alcohol, whatever it was, they just couldn't manage without that suppression.
Mm-hmm.
Bless them, I feel for them, I really, really do, because they don't know any of this stuff. But if they have good relationships and good family, you'll sail through life. But most of us, you were fortunate, Jackie. You were loved. That's stunning start. Stunning. Most of us didn't have that sort of start.
Yeah.
So, but this is why we have to create it as an adult, where your friends become your family. If your family suck, then, because we've got to just choose. And sadly, families cause a lot of pain as well.
Oh, yeah.
And we really have to back out, and I say it all the time. If it wasn't for families, I wouldn't have one single client.
That's true. Yes, I get that.
Because that's where it all starts. And I'm not a great fan of going back to childhood and clearing up stuff. It's just, sometimes it can dig a big deep hole. If you need to nip back and grab something, go, okay, that was the origin of this. Okay, now we're back in the present tense. because the more you go back to the childhood and dig in there, the more you go back to the childhood and dig in there.
Mm-hmm. Yeah. And then what? That's not great. I wouldn't have thought.
No, no. So,
I got triggered. I was triggered yesterday, and it's so good to realize what triggers you now. Like I'm very aware now of what triggers.
okay.
And so when my darling little dog is so frightened, petrified of the fireworks,
Oh, yeah, yeah, yeah.
yeah. And I've been very fortunate. Different friends have sent homeopathy stuff, and I've got a pipe fitting thing to go around him. Anyway, a girl messaged me the other night, and she was asking something about something completely unrelated, not to the dog. And I said, oh, I didn't answer earlier because my dog and I've been spending time with him because he's so frightened. And she said, and I said, oh, I've got the thunder jacket, I've got the homeopathy, I've got the calming smells and all that. And she said, you don't need any of that. You just need to understand your dog. Cool.
Maybe
So I just,
true.
so I just put a thumbs up instead of how I felt. Oh my goodness, you just need to understand your dog. And like I live with him.
Mm.
I mean, yeah, she probably had some sort of point, but anyway, yeah, good to realise what triggers you.
How dare she?
Yes, exactly. So this was what I read earlier. I will just say this, and then we'll ask anyone if they've got questions, because I think I've been through all the ones that I had that come in first. Um, the woman who believes she's always right will eventually ruin her marriage. And men, you can't love a woman who thinks correction is attack. You can't lead a woman who confuses guidance with control. Even on the days you speak with patience and wisdom, she won't hear you because of pride is louder than truth. And pride does coexist with peace, does not coexist with peace. Let's break it down. And then he talks about her ego will destroy her empathy. To her, every argument is a battle, not a conversation. She will push you into silence. So I read that. And there is always, like, a woman reading that we could be triggered, but actually there is a big thing to that. And it was very brave of the chap that posted it, that did leave his wife that he really loved. There's so much, because it was so related to relationships. I just thought it is really good to, I don't know if you want to say anything on that.
None of that went in.
Okay.
So I have nothing to say on it.
Questions. Anyone here that's got any questions that's happy to come on while it's recording, or did you want to put any questions in? We've got another question actually now. What did German new medicine say about the best way to journey through the menopause?
Menopause is a biological thing that goes on. But just be aware that a woman going through the menopause will change her perspective slightly and become more masculine to whatever degree. Sometimes really slight, sometimes quite major, depending on how masculine she was before, because always masculine, feminine sort of balance. Now, that can mess with the relationship a little bit, because if the man is still in the masculine realm and now the woman's becoming more masculine, then we may have to find a new way to communicate or to understand each other, that perspective is changing. It's not the same as it was. And generally speaking, a man goes through his big change when about 70, 75, where he becomes more feminine. But depending on what age the woman goes through a menopause, then there's potential 25 years of both wanting to walk through the door together, which can be a bit of a problem. So as for the whatever symptoms, I would look for any sexual conflicts, most definitely, because they can amplify the symptoms. And maybe working with a naturopath or something like that, because this is when as long as someone's not in a big healing symptom already, where it is good to diminish some of the overall load in the body. Uh, toxin, I mean,
It's breaking up,
just to
Bill.
ease the
Bill.
load with menopause, but it's not a genuine medicine. All right, sorry
Last set,
about that.
Bill. Sorry, the last sentence you just said, because you were breaking up, so we didn't hear it. Could you just repeat that last bit? Oh,
Hopefully it
you're
comes back.
freezing.
I don't know how much you missed there. Yeah, I don't know where from, but
I know, yeah,
there's
just
the menopause is a natural thing, so maybe a naturopath is a good person to work with, or someone like that who can diminish some of the symptoms at a physical level, and just be aware that perspective is going to change, going to be more masculine.
because
So
HRT, what would you say about HRT? Or you don't really know what, you wouldn't obviously recommend HRT.
it can be quite risky to mess with your hormones.
I mean, the thing is, I went to a menopause afternoon. It was an afternoon tea like of Alice in Wonderland, but with 3 doctors there. And I couldn't believe it. Marie, who's on here as well, she was with me. And the 3 doctors all really, really supported the HRT, which I'd never even considered. I only went because it was this lovely, it was only £5 and it was an afternoon tea. But it had these 3 doctors there and they wanted to talk about the HRT, I think. You know, I thought it was just you could ask any questions anyway. Anyway, yeah, so that was, but they were
Have you
really
got Scottish blood,
supportive.
Jackie?
They were really supportive of HRT. I couldn't believe it. But as doctors, they would be, wouldn't they? So blood cancer, Cherry's saying, blood cancer.
Blood cancer?
Is there a blood cancer?
Yeah, there is. Again, it's self-worth because the blood is self-worth. But it depends on the definition of blood cancer. Is it, because there's no actual blood cancer cells. There's no cancer cells floating around the bloodstream. They just don't exist. Uh, without going there, it's too late to go there. And I'm just aware of time. So there's never been an observed cancer cell floating around the bloodstream or the lymph, put it that way. But there is something that would be called a cancer of the blood, but it's more the blood vessels. And again, self-worth. We're looking at self-worth and the type of conflicts that are being resolved. And there's going to be a change in the cells, let's put it this way. Whether it's the musculature or the bones or the blood, there's going to be change in the cells. The activity is going to be different. So you're changing things like the the erythrocytes, which are the red blood cells. So if someone's been in conflict already, then those tissues, the red blood cells, the erythrocytes, they're going to be rebuilt. Yet again, there's going to be more of them to supply the oxygen and with the iron. Then now, when the medicine sees those changes in cells, they diagnose any change in cells as bad, as a problem, because cells are changing all the time. So it really depends on the diagnosis. So what I always want to ask someone is to say someone's been diagnosed with any ailment, then I always ask them how they know they've got that ailment. Now they say I've been diagnosed, and here's here's the diagnosis from the doctor. Then I say, well, why did you go to the doctor? Because I want to know if they just went to the doctor for a test, because people do. I'm not going to say anything about that. Or if they've had symptoms and a reason why they went to the doctor. Now, the doctors are really good at observing. That's what they're trained in. and they're really good at diagnosing most of the time, and that's what they're trained in. But their interpretation of what they observe is a problem because they can only interpret from what they've been trained. That's the flaw in the plan. Now, therapists are lousy. Bear with me. The cranial people and the bodywork people and and all that sort of stuff. Therapists, by comparison, are lousy at diagnosing. The doctors are really good at diagnosing. The cause, forget it. What to do with it, apart from surgery and drugs? Nothing. Therapy can help minimize the symptoms, ease the symptoms, or ease how someone feels while they're dealing with the symptoms, whatever's going on. So they're both valid, but I always want to know the reason why someone went for a test in the first place. And that'll tell me more about the attitude of the person, and then my communication is different.
Interesting.
And my questions are different.
Yeah. Thank you.
Because we've all been programmed to varying degrees to believe the medical system is correct. And if someone still believes that as an adult, then I'm dealing with a different type of person to someone who only went there because they had big symptoms going on and they wanted to check out where it was.
Mm-hmm. Thank you. And I was thinking of this earlier as well, and Bray's just put what about parasites and mold? Well, I was going to ask about parasites because I've seen so many people post recently about how to clear parasites from your body. And so Bray's is saying about parasites and mold. I mean, I wouldn't even have thought of parasites if I'd not if I didn't keep seeing these posts on Facebook about parasites in the body.
Yeah, sure. We have a lot of things in the body that would be classed as foreign invaders, but they're part of the biological cleanup team. And depending on what you mean by the actual specific parasites, then most of the stuff in there are there as part of the mop-up team where we are stuck chronic in conflict, especially with the digestive system. So because if there's nothing to eat, they won't be there. It's straightforward. And they're there as part of, that decomposing process. Now, you can get in the digestive area, especially, and obviously we include the liver in that as well. So you can get cell multiplication temporarily in the small intestine, the large intestine, and it could be there to aid those organs in being able to digest the food better. Now, this is about anger that pushed down, but with a sense of lack. And the lack could be love, it could be respect, it could be money, it could be food, it could be anything at all. And but it's that anger we have to keep pushing down. And the feminine will push down more than the masculine. The masculine will express, generally speaking, and the feminine will push down. Now, you can't carry on pushing down forever. Now, if it's indigestible anger, that means you're not able to digest the food in the way that you'd like to. So the small intestine and the colon is going to produce extra cells to be able to aid in the digestion. And there's two different types of cells are produced there. And if you get in and out of that conflict for long enough, then in the breakdown of those extra cells when they're no longer needed, or at least temporarily, then there'll be, just like a builder, ripping a house out. They'll have skips outside for all the debris. Now, our digestive system's the same, but there's no skips. So all those little cleanup artists will be in there. Now, if we get stuck in the conflicts for too long, there's going to be more, and it's going to cause a problem.
Something important went through my mind just then and I've forgotten what it is. Jerry said her body makes abnormal cells. That goes back to the blood cancer thing, but I think you spoke of that anyway. So what time have we got now? 24. Yeah. Is there
I
any
just want to say,
last?
Jackie,
Yes.
I just want to say there's no abnormal cells in the body, even if we're told that, but the medical people, I get it. Now, what there is a change in the cells. Now, remember, medicine views a change in the cells as bad, and they also see, so the medical definition of cancer is a multiplication above a certain number in a cell. This happens all the time. And it depends on the cell, where it is, and what the symptoms are. So there's always changes in the cells. Otherwise, your hair would be the same as it was, 20, 30 years ago. Your fingernails wouldn't grow. Nothing would, our body's going through this shedding process every millisecond to some degree. One other same person we were last week or the week before, or 6 weeks, or 3 months, or 6 months, or a year. There's always a change in the cells.
Yes.
Now, it seems to be in medicine, if there's a change in the cell on the outside, it's okay. If you fall off your bike and you put a massive wound in your knee on the outside, it looks horrendous. And you got all that pus and everything around it, and the medical system and all the scabs and everything, the medical system, that's fine. That's normal part of healing. But if it's the inside of the body, it's a different story. It's a cancer problem.
We just have to believe what they tell us because we don't know any different. But
this is why it's really good to be as informed as we can, because the whole thing about this is to be as preemptive and looking after ourselves as possible and be as independent as possible, so we don't need to go there apart from accidents and stuff like that. So, because once you're in there, no disrespect to the doctors and nurses, there's a fear-mongering machine that benefit from the fear-mongering because it's big business. The string pullers is a business model for the doctors and nurses on the ground. It's damn hard work, and lots of them genuinely want to help people, and they're really good at what they do. But they can only work within the system, and they can't do anything outside of that because their feet won't touch the ground. I feel for them because they're more controlled than anyone.
Neil, thank you so much for taking the time to share all this with us and answer all these questions. Is there anyone that's got a burning question just before we finish? I think most people have put in the chat box anyway. Brilliant. Yeah, thank you, Bill. Got some right insights and another angle. Honestly, it is brilliant. Thanks a million. Yeah, it honestly is good just to look at a different perspective and just realize that it's relationships, not illness.
Absolutely.
Or yeah.
Circumstances of relationships and how we feel about them or perceive them.
Have you got a website where they can go to for the 12 course? No, so just get in touch with me.
Oh, sorry, get in touch with you, Jackie. Yeah.
Yeah, get in touch with
I
me.
closed my website down a bit.
Yeah, no, because you've got the 12-part series so I can put you in touch with Bill if you wanted that. Okay, wonderful. Sure. Thank you all for joining tonight. Oh, it's just fascinating, this subject. And there is still so much that we could probably talk about, but we can come on again, no doubt, in a few. Thank you so much. Thank you, everyone.
Pleasure.
Thank you so much.
You,
Thank you. Good night.
Bye.
Bye for now.